So today we're going to be shortly introducing everybody, but just have a wee shout out, tell us where you're from. So we're in Christchurch, which is the centre of the South Island. So this is New Zealand's sign language for New Zealand, this or this, but this represents the two islands. So we're in Christchurch, which is the centre of the South Island. So good morning to everyone. Kia ora, morena, aloha. And bonjour to everyone that we can see coming in this morning. So we'll be starting shortly, and I can see we've got a lot of people in England. I know it's still Sunday night in England, and America's got some an interesting week ahead, I guess. But we're not going to talk politics here today. We're going to talk about New Zealand.
Oh, they're coming in from all over.
Yep. So Jen's originally from South Africa, and tell us where you're based, Jen, before we start.
Yeah, so I'm in South Taranaki, so that's kind of central and west on the North Island, and we just love it here. We're surrounded by dairy farms, and it's very peaceful and calm, and that's what we wanted. Charlotte,
where are you based, Charlotte?
Sorry, I am based in Hamilton, so we are not quite the middle of the North Island, but most people around the world are aware of Auckland, and we are about an hour to an hour and a half south of Auckland.
Fantastic. We often hear a lot of people talking about the difference between the North and the South Island, the weather and the people and the friendly rivalry we've got. I think Christchurch is fabulous, but I would live anywhere in the whole of New Zealand.
Yep.
I would leave the west coast of the South Island. I would live in Whangarei or Northland at the top of the North Island. Auckland might be a wee bit busy for me and my family, but I love Wellington. I was there a couple of weeks ago and I absolutely love Wellington. And I was in Hamilton. We were there about 4 months ago, and that's a fabulous place. It's the best of both worlds, not too far from Auckland.
Yeah,
we were in.
It's nice and central to a lot of things. We've got beaches less than an hour away. We've got mountains and snow 3 hours away. We've got Auckland an hour. So yeah, we're pretty lucky, I think.
Too far from the beach for me.
Okay, everyone. Hey, it's 9 o'clock in New Zealand time. So I just want to say a big welcome, kia ora, to everyone from around the world who's joined into our webinar. We're going to be here talking today all about New Zealand, specifically to medical migrants. We're going to be talking through the process of working in New Zealand, things like interviews, CVs, references, registration, and the process of coming to New Zealand. So we'll go through the whole registration process, the whole interview process, and I have my absolutely wonderful colleagues, Kristin and Hayley, and they will be answering questions for you in the chat room. So hopefully you can see the chat room here. Now, I guess just by way of background, we've got the internet all around the world that we're relying on. So we're hoping that your bandwidth is going to give you good coverage so you can hear and see us okay. Please let us know if there's any issues. I'd like to introduce Charlotte, or I'd like to get her to introduce herself. And then I'll get Jen to introduce herself as well, and then we'll start talking through some questions. So Charlotte, tell us about yourself.
Hi everyone, I am Charlotte. I am a licensed advisor with New Zealand Shores, as you just heard, based in Hamilton. Been working with plenty of healthcare professionals, care of Prudence. Quite a few have come our way from Accent Health. So yeah, we've had a number of families migrate, but we're a consultancy of 10 licensed advisors. So we're well versed in all matters relating to immigration. So yeah, here to answer some questions about how that process looks like, specifically to health professionals at the moment. So hopefully we can help you and your family migrate.
Great, thanks Charlotte. It sounds like you've got a good Kiwi accent there. Jen, let's hear about you.
So I'm originally from South Africa. We spent 11 years in England, and then I moved to New Zealand in 2011, and I'm very proud to say I'm a citizen here now. So I have immigrated twice. I have a YouTube channel, and on there I upload vlogs and videos about moving to New Zealand and a range of lifestyle topics. And I also have a Facebook group for moving to New Zealand. And so that's for people who are planning on making the move or those who have made the move to support each other and share experiences. And we have over 16,000 members there. And it's a really nice atmosphere. It's a nice place for that peer support.
Great, thanks, Jen. Yeah, I know that the Facebook page is very, very popular, and it's a wonderful place, and your YouTube videos are awesome. So look, everyone, today we're just going to have a reasonably informal Kiwi-style webinar and go through some questions. If there's anything specific, as I said, just jot it down in the chat room and we will try and answer it now or later. So Jen, you've got some questions for me, having come, you've migrated, so you've got questions that might be appropriate for people coming from overseas.
Yeah, so I'm not a medical professional, but I'm going to play one for today's webinar. So if I was on the fence, I'm thinking of leaving my country, I'm planning on where to go, that's a big decision. So why New Zealand?
Yeah, Jen, look, that's a really good question. And I ask people when I interview them, why are you coming to New Zealand? First and foremost, lifestyle, safety, weather, cost of living, geography, beaches, and my favourite one is the people. So I think the New Zealand people are really, really open and honest, but like the South Africans, sometimes nice and direct, and they give you an open, honest answer. We've got a fabulous health system, and I think our results from the pandemic speak for themselves. We work really, really closely with all the district health boards and the private hospitals, and the information that we can give you today on working in New Zealand, I think, will be invaluable. But New Zealand, I think, is the most fabulous country because it's a long way from a lot of places, but with the internet and the World Wide Web, you're close to everywhere. So I think it's a very, very popular place at the moment politically as well. But we're not going to talk politics today. But I think our leader, Jacinda Ardern, who I've met, is absolutely wonderful.
You don't need to sell it to me. I love it here too. But if I were thinking of making the move, I'm a medical professional, and I decide I need some help with the job placement, how does Accent actually work?
Okay, so coming to New Zealand, there is obviously a big process, and we have 3 Ps: preparation, planning, and patience. So the preparation's really, really important. We get a copy of your CV or your resume, and we can send you a copy of a resume. If you've got any questions about your CV or would like a CV, if you could please email info, that's INFO, at accent.net.nz, if someone wants to perhaps type it in the chat bar, and we'll send you a free copy of a CV specific to your occupation. So pop your occupation down there and also a CV, please. So we'll get your CV ready. We do reference checking, which is really important for the medical council or the registration boards, and we also take you through interview practice. So we'll take you through the interview practice from start to finish, and interviews we'll talk a little bit later about, but the interview practice is really important to get you to understand a little bit about the New Zealand culture. We do the reference checks, which are really important. Get your CV, present them to a potential employer in a location and a specialty that you want to work in. So if, for example, you're a general practitioner, a GP or family GP, and you want to work in the city centre, we look at that for you. If you're a physiotherapist and you want to work in a smaller area, we'll look at smaller areas, perhaps more rural areas that are more appropriate for you. When it comes to the immigration side, Charlotte can talk about that a little bit, but once we get you up to the job offer, which is vitally important for your visa, Charlotte takes over from there.
So what is the visa process then, Charlotte? How long is this going to take, or what do we need in terms of paperwork? Can you talk us through that?
Yeah, so everything has significantly changed since our border closed or became highly restricted in end of March. So important to note that for healthcare workers, the border isn't closed. You still are able to enter New Zealand. It's become more like a 3-step process at the moment. So once you've got that job offer, what we do is we apply first for an exemption to enter for you as a critical health worker. That is for you and your family. So if you have a partner and children, they're all included in that exemption to enter request. Once that's approved, we then apply for what's called a critical worker visitor visa. That takes pretty quick actually. At the moment, they're sort of processing in 1 to 2 weeks. So between the exemption to enter request and that critical health worker visitor visa being approved, you're probably looking at about 2 to 3 weeks in total. That once that critical entry visa is approved, that's your ticket to come to New Zealand, or it's your visa to enter. You still of course have to pay for flights, but that is what will allow you to enter New Zealand despite our border being restricted. Once onshore, you will have to go into managed isolation. You have to apply for a voucher through a website that's miq.govt.nz that talks you through the whole process of managed isolation in New Zealand. You will have to pay for managed isolation on arrival. Charges vary depending on whether it's just one individual or you and a family. So you can perhaps, Kristin or Hayley can jot that website down in the chat and you can follow that up and have a look yourself. Once you've undertaken your 2-week isolation, you're able to leave, providing you're COVID-free. And sometime between you arriving in New Zealand and you starting work, we would also apply for what's called a, well, it'll depend on 1, where you get employment, and 2, what your role is. So it would either be what's called a work to residence work visa, or an essential skills work visa. Some district health boards are accredited employers, hence why we can apply for that work to residence visa. Some sort of like private healthcare providers and some district health boards aren't accredited. So in that situation, it's an essential skills work visa. Just to sort of backtrack a little bit, those critical purpose healthcare worker visitor visas do actually allow you to work straight away as well. So you would be able to start work while your, proper set of visas are processing. In terms of paperwork, it's sort of all of your standard stuff. Identity documents, you will require police clearances from countries of citizenship, plus any country you've lived in for 12 or more months. You will need to have a medical done. That can actually either be done in your home country or where you're residing, or it can be done once you're onshore in New Zealand, as it's only required for those work to residence or essential skills visas. You will need probably an occupational registration. Most of the people we're talking to in this group today will require some form of registration, and that's Prudence's area of expertise, not mine, so she'll be able to talk you through that. And then, yeah, depending on whether you're bringing a partner or children, will obviously then be key as to whether we have to provide evidence to show, the children are biologically yours or you've adopted them, as well as evidence to prove that you are in a relationship with your partner. So yeah, that's sort of a very brief overview of what we're looking at, but none of it's too difficult to obtain for most people.
Okay, Prudence, we've jumped ahead to visas, but we need to back up a little bit and get back to getting that job, because that's what it's dependent on, isn't it? That's a big cog in the whole process. So it sounds like Accent offers a really comprehensive service, and as a potential candidate, I would be wondering, what's this going to cost me? So what are your fees? Because immigrating is expensive.
Absolutely. Thanks, Jen. And thank you, Charlotte. I can't keep up with the changes that we've had, but they're all very sensible changes, and they're changes that are only positive for medical professionals. As you can imagine, the whole of New Zealand immigration is only concentrating on health professionals and only letting health professionals in, which we're delighted about. So thank you. Jen, we don't charge for our services. All we ask is that you are open and honest and transparent in your transactions with us. We don't charge. The hospitals will pay us when you arrive and start work in New Zealand. So there's no charge to you. It doesn't affect your salary. And I know people say, how can I believe that? You can have a look at our case studies and see how we work. I've been recruiting now for 25 years, and I'm a nurse by background. My colleagues, Hayley and Kristin, have been working with me for many, many years, 16 in total. And we're really good at what we do, we believe, and our clients believe that, and our candidates believe that. So there is no charge. We just work exclusively with you. So you are a priority to us. And bear with us at the moment. We've never been so busy. And I hate to say we're busy because it sounds like we're a little bit arrogant, but we are a little bit flooded with inquiries. So it does take us perhaps a day to get back to your emails. At the moment, the US and the UK are really, really wanting to come to New Zealand, which is great.
Yeah. So if I decide this is great, I want to go ahead, this is going to work for me, I would have the question of registration, and I'm seeing it popping up in the chat as well. That's quite a big hurdle as well. How do you translate the registration from various countries to be relevant and accepted in New Zealand? Do you help with that, and what is the process?
Yeah, absolutely. The registration process is probably about 2/3 of the process of coming to New Zealand. For all medical occupations, apart from doctors, all medical occupations need their registration first before they come to New Zealand. So they need their registration first. So for example, nurses will submit their nursing registration through the New Zealand Nurses Council, email us and we'll send you the link. For the physio board, that's quite a complex application. Email us, we'll send you the link for the physio board. Just send an email and say, I would like the link for the registration. This is my occupation, to info@accent.net.nz. And Kristin and Hayley and I can follow up over the next couple of days. The registration is really, really important. You have to get the documents, for example, the transcript of your training, how you trained to become a nurse in South Africa or the UK or the US or Singapore. The registration board for midwives is a little more costly, and it's slightly longer that you do a process in New Zealand as well. But again, we can send you that link. So every registration board is different, but they all have a similar element. They want to check your training. They want to check that you've got a high standard of work ethic, and that would be in your work practice. And then you haven't got any discrepancies or any fines for your work experience in the UK, US or country of origin. They want to check that you have a good all-round training and experience that is comparable to New Zealand. A lot of the countries that come and want to work in New Zealand we can't accept. There's about 22 that we can accept. So pretty much everyone here who's on this webinar we can accept, but you do need to go through the process of checking your transcript, checking your education, checking your experience, your references, and get a certificate of good standing or professional standing. So it's quite an involved process to get registration, but once you've got it for life, which is fantastic.
Okay, so that sounds like you've gathered all the information about me. Are there any other requirements for the CV?
Yeah, the CV is really important, and we will send you a template as per your occupation. We're a little bit fussy on CVs. Personally, I really love to have a photo on a CV, but that's entirely up to you. We need a short summary to start with, your motivation to come to New Zealand. We need to have your reference details with their name, their cell phone number, their email, and their relationship to you. Reference details are really important because the employer wants to offer you a job, but they have to get hold of your referees, and that's part of their process. You need to have accurate information there. Also, if you're working in, for example, St Thomas's Hospital in London or Johannesburg Public Hospital or Kaiser Permanente in the US, please describe the hospital to us and put in the website, because we're going to want to know what your patient population is, what kind of surgeries you do, what kind of people you see, what your waiting lists are, what sort of skills you have to work in that hospital. So it's really great. We like about 4 to 6 pages for a CV. So resumes are quite short. They can be 1 or 2 pages, and some CVs are 20 to 40 pages, but let's just stick to 6 pages. And we're always happy to check your CV this end before we send it out to an employer.
Okay, so you mentioned references. How do I prepare for the reference checking, and kind of at which point will that happen?
Great, yeah. We actually check references when we receive the CV and permission from you to do so. So we check references at the beginning. So when we send your CV, Jen, you're a theatre nurse and you want to work in Auckland. So I'm going to check your references from your 2 current and 1 past employer. I've got quite an involved reference form that I need to fill them in. So get their permission. We'll email a reference form and follow it up. So when we send that CV to the employer for you to get a job, it'll already have 3 references there, which will be fabulous. So the potential employer looks at Jen's CV, the theatre nurse from Johannesburg, and says, wow, these are great references. It backs up her CV. It confirms that she's on time. She's got a great sense of humour. She's got great work ethic, and she's worked in these surgeries before. She's done hip replacements. She's done a bit of recovery. She's done spinal surgery, and she's done delivered babies or whatever. So it's really important for us to know, and the referees to back up what is in your CV, and also we need to know that you're going to fit the culture of the job.
Okay, so I'm on one end and they're on the other end, and they like the sound of me, and you kind of the matchmaker. So I guess there's a point where they're going to want to speak to me. So can you talk to me about the interview process? How is that done? What kind of questions are asked?
Sure. Yeah, the interview process, the majority of the time it's by video, so it's by Zoom, and all you guys are on Zoom now, so you're all really great at that. Sometimes it's by telephone, sometimes it's FaceTime, sometimes it's Skype, sometimes it's Microsoft Meetings. You could get a huge variety of interviews, but we do an interview preparation with you. And in that preparation, we'll talk through a little bit about the Māori health and why that's important to understand for New Zealand, how you work with different cultures, because we've got a magical melting pot out here in New Zealand. We'll prepare you so technologically you've set up that you're not holding on to your screen, and that you've got it set nicely, that you've got a nice bland background, and that you've got a good voice to speak and introduce yourself. There's two tough questions that people struggle on, so I'd suggest that you practice that, everyone, is tell me about yourself and why do you want to come to New Zealand? I'm sure, Jen, if I asked you, what do you do with CPR? How do you deal with a drug reaction? What do you do if a patient becomes agitated before theatre? How do you discharge a patient? You'd be perfect at answering that if you're a nurse or a doctor or physio or midwife. But questions about tell me about yourself. So if someone said to me, tell me about yourself, I'd say, my name is Prudence. I'm a registered nurse. I'm 51, just. I've spent the last 25 years recruiting. I particularly enjoy travel when I'm recruiting, and while I don't travel, I spend time with my family. My main skill as a registered nurse is working in theatre, anaesthetics, recovery, dealing with acute cases. So that would be a nice introduction, probably 2 minutes, if that, and going through 80-20 rule. So 80% of the time you're talking about work, and 20% of the time you're talking about yourself.
Okay, that's good to know that you're there to give that kind of guidelines. Is there anything else that I would need to do to prepare for an interview?
Yeah, I think it's real. There's a couple of other things, and we can send you some, once we get to the interview stage, we'll send you some interview preparation document. Really important to research, for example, the hospital you're going to. If I'm going to Auckland Hospital, I really do need to know how many beds, what's the patient population, what are the specialties. They don't tend to do burns. They go to Middlemore, for example. They don't, spinal goes to a slightly separate area. Just an example of a little bit about the hospital. Oh, I know about Auckland Hospital. I really want to work there. I understand that this is the population. This is the type of admissions you get. This is the hours that you work. And honestly, if there's a question you don't know the answer to, you say, I don't know the answer, but I'd like to find out. For example, if in an interview, they asked you, what equipment do you use during intubation? Or what do you do if you're with a calming and restraint patient and working in mental health? You'd say, look, I don't know what I'd do in New Zealand. I'd have to find out. So, yeah, so I think, and the other thing is what to wear in an interview. Something plain, not stripes. Stripes get a bit fuzzy on a video.
Yeah, so that sounds, like I said earlier, really comprehensive. You've been there every step of the way. We've made the match. I've had the interview. I've had the job offer. And it's so reassuring to know that I can then move on to New Zealand Shores and get that same support and service. So Charlotte, can you talk us through some of the challenges about moving to New Zealand and the ways that you can help?
Yeah, absolutely. Everyone's situation is different. No two families or no two people that we deal with are the same. Everyone has a unique set of circumstances. Everyone has a unique situation, a unique job, unique skills. So we really work with individuals and their families to figure out exactly what we need to make sure their visa applications are going to be approved first time round with as little delays as possible. For some people, there are no challenges. For some people, things sail through really quickly with no issues at all. For other people, they may have difficulties getting things like police certificates. We have a lot of South African clients, and police certificates, birth certificates, notoriously hard to get from countries like South Africa. Obviously, a lot of the people here from the UK and the US won't have those same issues, which is really good. One challenge a lot of people are finding at the moment, a lot of our healthcare workers who have got jobs here in New Zealand and are traveling from various parts of the world, is actually getting flights to New Zealand at the moment, because obviously international travel is so restricted. So, you know, you might need to take that into account with your plans, as well as talking to people like Prudence and your employer to discuss, you know, this is realistically when I'm going to be able to arrive. Things are moving really quickly with visas at the moment for healthcare workers. So you may find that everything happens really quickly and suddenly you need to get on a plane and get to New Zealand and undergo your managed isolation so you can start work. So I think being one, document ready, so having all of those documents ready to submit your application once that job offer is approved will actually mitigate a lot of challenges that you could potentially face if you weren't document ready, and then being in a position to be move ready as well. So knowing you've got a job, making sure that, you know, packing up your life to move isn't a massive undertaking at that point in time. You might have already decluttered your house, you might have already sold your house and moved in with family. So making sure you've ticked off those few things to make the process as straightforward as possible will really help in your migration plans.
Yeah, having immigrated twice, I can tell you it is quite the endeavor, and there's so much that's going on with the logistics. So somebody at this point may be getting cold feet. So I've already asked Prudence, but I'll ask you now, what are the best things about New Zealand?
I couldn't say a bad thing about living here. I will admit I haven't lived anywhere else, but I have lived in 2 different parts of New Zealand. I quite often say at the weekend, one of the best things about New Zealand is you're never too far from being able to get out in nature. One of my favorite pastimes is hiking or trail running. And no matter which direction I drive, I'm only 20 to 40 minutes away from being able to climb a mountain or find a trail to go and run on. You can also do it without worrying about snakes or spiders jumping up and attacking you. So for me, that's a bonus. The outdoors lifestyle here is wonderful. The people are really friendly. We are such an inclusive society. Having dealt with people from all over the world, I've never had anyone come back to me and say that they've had a bad experience, which I think's really, really wonderful. We have beautiful beaches. We have great weather. It's not too hot. It's not too cold. So yeah, I'm pretty biased, but I think New Zealand's pretty great.
I agree with all of those points, and I have lived in other places. So one thing I love about New Zealand Shores and Accent is you really care about the people that you deal with. And once you have your job, you have your visa, you have your placement, you're over here, what is the best way to go about meeting people? Because I know New Zealand Shores doesn't go, well, you're here now, goodbye. You kind of have an interest. So how do you go about meeting people and begin settling as a migrant?
Yeah, you can go first if you want, Prudence.
Yeah, look, we spend a lot of time introducing people to each other, assisting people to network. We've always had the vague romance come out of people meeting, medical professionals traveling and meeting up together, which is pretty cool, but a lot of really, really awesome friendships. You know, people who come to New Zealand have got the same mindset of why they want to come, which is really fantastic. And, you know, their values are aligned, so they get on really, really well. So we network people, we give you a social buddy. We do a thing called pay it forward. So when you arrive into New Zealand, someone will take you out for a cup of tea or a beer or wine, coffee, and say, hey, look, this is where I go to the beach. This is a great place to buy a car. This is a good flat. And then they pay it forward. So the next person knows that then when the next person comes in, they might have been there 6 weeks or 6 months, say, hey, there's a new doctor in town, you know, they're going to be working at this hospital. Do you want to meet them for a coffee, show them around? You know, they might have kids, they might not. We try and just give you a bit of a social buddy.
Charlotte, what do you think?
I will be honest, we don't provide the same networking service that Accent does, but obviously everyone in this webinar would be able to utilize that, and I think that's a really wonderful service, Prudence. I haven't yet had a family come back to me saying they've had difficulty settling, because New Zealand's so inclusive. I think the day you start work, you would have invitations to come for a barbecue or go to the beach with someone or catch up for a beer or a coffee. Kiwis is the kind of people who will just do that without any thought. The new kid on the block is always included. I can say the same for what's happened in our office. Every time someone new's joined, it's, hey, do you want to grab a coffee? Do you want to go out, catch up, come over for dinner, bring your kids over, let's hang out. So you're not going to struggle to settle and find friends. There are also a lot, you know, because we have a lot of migrants, there are big migrant communities in every city. So I've had people, especially South African clients, say that they actually know more South African people and have more South African friends in New Zealand than they did in South Africa. So yeah, I don't think you'll be hard pressed to find people that you have things in common with.
That's what I found moving over, is that New Zealand people are very inclusive. You show up as you are, it doesn't matter your background, where you're from, you're just welcomed. And it does help to put yourself out there and make the effort, because when you're the new person, everyone else is kind of living their lives and going through their routines. So you really need to make the effort, but it's worth it. And I have amazing friends here. The people here are so lovely, and there are so many immigrants who understand what it's like to be the new person. So those are some more general questions. Should we jump straight into the more specific questions that we've had coming through from potential candidates? And one is, what are the education requirements for a US registered nurse to apply for a job in New Zealand?
Yeah, that's a really good question. The requirements for a nurse from the US to come and work in New Zealand is a degree, not an associate's. So it's a degree to work in New Zealand, and it's 2 years postgrad experience. Pretty much everyone is 2 years postgrad experience and a degree. There's slightly different people like operating theatre technicians, midwives, we need a degree or the equivalent. You do not generally need to go through NZQA, which is great because that can be quite expensive, but you will find that almost all the medical training and experience from overseas will be equivalent with a degree and 2 years postgrad experience. But having said that, we talk to people well before coming to New Zealand, and you know, even if they're coming in 2 months, 2 years or 10 years, we start chatting now, which is great.
Okay, so if you're just thinking about it, it's worth getting in touch.
Yeah, absolutely. Yep.
Okay, there was a question, would a nurse experienced in managing the care of high acuity COVID patients be potentially in higher demand?
That's really interesting. It's funny how everybody's CVs have taken a wee segue and deviated slightly. So a lot of the CVs that we see, they're theatre nurses, they've gone to work in ICU to look after COVID patients. They're perhaps working in cosmetic surgery. They've stopped that because there's no demand for the moment. They've gone and worked in COVID and ICU in the COVID wards. We've got people with really great intubation skills, really great swabbing, assessment, and dealing with respiratory illnesses. Strangely enough, we don't need that in New Zealand because we haven't got COVID, but touch wood, but it's quite a challenge trying to look at some of these CVs, and we're looking at where they will most be appropriate. But most skills are transferable. So if you can work in theatre and you go and work in ICU, that's sort of a bonus, bit of a silver lining, yeah.
Right. Dentists. Wanting to know if dentist is on the list.
dentists aren't on our list, but I'm more than happy to send through some information. There's a company called Lumino, which is Lumino, and they will assist you with employment if that's the need. We have had dentists come through to New Zealand who've been wives of GPs or surgeons we've worked with, and I know that they've got employment, but it's not an area of specialty for us.
Okay, that's good to know that you do have a contact to pass them on to.
I'll just jump in there. Dentists are on the exemption to enter list. So, and we have had one dentist arrive in New Zealand since the border became restricted. So if you are a dentist, reach out to us and Lumino, and we can sort of give you some more information on that. But yeah, you can definitely still enter at the moment.
That's great. Really good.
Just talking about that entering process, at the moment, I've got 7 people in isolation in hotels around New Zealand, which is really fun. And on Saturday, I went and waved at 3 of them through the fence, which is really cool. There was a GP from Singapore, a really, really clever endoscopy nurse, and another GP from England. And their process took 2 weeks to get the entry visa and about 3 to 5 weeks to get their essential skills health visa. So it's been, it was the funniest time meeting someone, because usually we go meet people, pick them up from the airport, but they isolate for 2 weeks, and perhaps we could talk a little bit about the isolation, but it was really cool seeing them. I took them some groceries and some chocolates and trick-or-treaty stuff, and it was quite fun meeting them just through the wide fence at a 2-metre distance, because we want to know that they're clear before they come to New Zealand.
Yeah, do you want to talk about the isolation process?
Yeah.
Because that's a bit of a mystery for some people, what actually happens. And
it is. So now it does change slightly as the processes are refined, but at the moment you do 14 days isolation. So once you get your job and you get your visa, you book your isolation ticket and your flights, and then you're allocated a hotel the day you arrive. It might not be in the city that you land in, it might be in a different island, but basically you're allocated a isolation facility for 14 days. This is a 4 or 5-star hotel. So we're talking about Hiltons and Sofotels and Distinctions and M Socials, some really gorgeous hotels. Some families, it's a bit of a lottery, have had a suite. So they've had a massive king bedroom with a separate bedroom with 2 separate beds for their 2 and 4-year-old, and a little kitchenette. So they've been really lucky. So you isolate for 14 days. It costs $3,100 New Zealand, which is about 2,000 American for 14 days for hotel, Wi-Fi, food, and medical care. So they'll do a swab on day 3 and a swab on day 13. If you show any symptoms that are aligned with COVID, you are moved to a quarantine hotel. They're pretty strict. You're looked after by nurses, by the army, the military, and the police. And the feedback I've had has been amazing. The police talk to the kids, they smile. Of course, we don't have guns. The police don't have guns, which is really, really cool. And, you're on first name terms with all the staff there. There's allocated times where people can go out and exercise. So you can exercise up to 7 times a day in some hotels, twice a day in other hotels, and free reign in other hotels. So there is a little bit of difference between where you're isolating. But basically, you are here for 14 days to make sure you're clear of COVID and we keep it out of our community. So you're really, really well looked after. And the great news is, this far, every employer has contributed or paid for the cost of isolation, which I think is amazing, of our district health boards, our small general practices, paying for the isolation. So otherwise it comes out of our taxpayers' money.
That was actually one of my questions, was who pays for that?
Yeah, and if you do test positive, you're looked after, you're treated until you're asymptomatic. I think it might be for 9 days. But we want to make sure that don't have symptoms of COVID and you're not positive. So we're really careful about keeping it out of our community.
Thank you.
Yeah.
for covering that. There's a question I've actually seen pop up quite a few times in my Moving to New Zealand Facebook group, and that is the role of physician's assistant. I believe that's a job title in the US. Can you talk about that? Is there something equivalent, or is that something that is the role that you face?
I've talked to a lot of employers about PAs, physician assistants. We don't employ physician's assistants in New Zealand. We employ nurses. So that's not something we can help out with. And unfortunately, at the moment, it's the same as a surgical assistant. We don't tend to employ those, but that may change. You know, if you keep an eye, like our Facebook page and keep an eye on that, perhaps Kristin or Hayley could put our Facebook page there so you can put a like on that and then you can keep up to date. And if there is a change with PAs or surgical assists, we would love to have you, because I know they're very, very valuable. And I look at these PAs' CVs and I get so excited and really look forward to, you know, one day being able to employ them in New Zealand. But at the moment, we've got registered nurses.
Thank you. I wonder if Kristin could add my group link. It was also asked in the comments. If you can pop the group link, and if you mention when wanting to join the group that you come through the webinar, you'll be approved straight away. So that can be a process. Charlotte, there's a question for you. If a health professional gets a work visa, will their spouse also be able to work in New Zealand if they're not a health professional?
Yes, absolutely. So the person who is the medical professional will be what we call the principal applicant. So the principal applicant's visa will be tied to their employer, whether it's a hospital or a general practice or a private healthcare provider. But the partner will obtain an open partnership work visa. That open work visa allows the partner to work in any role for any employer for as little or as many hours per week. On that note, we quite often get the questions that, you know, does my partner have to work? Particularly that comes from people with young children or children that they want to get settled when they move. The answer is no, the partner doesn't have to work. It's just that the partnership work visa is the most logical option. So the partner basically has all the freedom and the easy ride, so to speak. So yeah, that's really great for them. Children, so there was a question I answered in the chat, but I'll just quickly go over children as well. At the moment, with those critical healthcare visitor visas, you can only include dependent children up until the age of 19 at present. Any children over the age of 19 don't fit the policy for temporary entry visas for dependent children. However, when it comes to applying for residence, so 99.9% of people in this webinar will have a path to residence. When you apply for residence, you can include dependent children up until the age of 24, and that's inclusive. So it's effectively up until the day they turn 25. So your children might not be able to join you immediately, but they will be able to join you at some point as long as they fall under that 25 age bracket.
That's reassuring. There was a question, I believe, for Prudence. Do American Board of Emergency Medicine certified ER doctors require additional qualifications to practice in New Zealand? And then they mentioned their wife is a pediatrician.
No, not at all. Board certification means that you're qualified to apply for registration in New Zealand with the New Zealand Medical Council. So if you've got board certification from the US, you're almost guaranteed to get registration to work in New Zealand. Just another question I might ask myself and pick up on, are there jobs available in rural and urban areas? Absolutely there are. We've got busy city practices looking for doctors and nurses and small rural areas as well. And I go back to my New Zealand and North and South Island. We're right up the north and right down the south, Invercargill, which is a great place, Christchurch, the West Coast. So all around New Zealand, you will find vacancies. It's not specific to rural areas. But
that's a real...
Having said that, be open-minded and be flexible. As I said, I'd work anywhere in New Zealand.
Yeah, that is a real advantage to have some choice in terms of area, because usually it's, you know, you go where you get the job. So that's quite good that medical professionals have that advantage. They can have a bit more choice about where they're placed.
Yeah.
Charlotte, I'm glad you covered the age of children. We've also had a question about parents. So that's a bit more tricky, isn't it?
It's very at the moment. So we got really excited start of the year, prior to COVID even being a word I'd ever heard. They had reopened the parent category, which we had been waiting 3 years for. Unfortunately, nothing's happened with that. They've put all expression of interests on hold for the parent category. So watch this space. That one is also a little bit hard to talk to, because in order to sponsor your parent, you have to first be a resident for 3 years. And I get quite cautious about talking to prospective migrants about that, because I don't know what the policy is going to look like in 2023 or 24 or 25. It could completely change. If we have a change of government, it could change again from what it is now. So yeah, I am very cautious. If you do have specific questions, feel free to reach out to New Zealand Shores and we can discuss that. There is a second option, which at the moment is quite a bit, I say easier in terms of processing, but not necessarily easier in terms of meeting the criteria. It's called the parent retirement category. The moment you get your residence, you can become, well, you're not so much a sponsor, you're more of a supporter of your parent's application. It is a investment-based visa, so it's not that easy to meet for a lot of people. Your parents must have a minimum investment of 1 million New Zealand dollars, plus 500,000 settlement funds, plus a guaranteed annual income of 60,000. So yeah, it is quite tricky to meet. I wouldn't say we do hundreds of those applications. It's probably maybe 3 or 4 dozen a year. But they are processing. So Immigration New Zealand has resumed processing for that parent retirement category. So it's a good thing that is happening. But yeah, once again, I would recommend reaching out to us to see if your parents may potentially meet the thresholds for that category.
Okay. I see in the group people asking questions that are directed more at New Zealand Shores, and we're lucky to have Julia in the group with us to answer them, that are health related, because that is one of the requirements for visa, isn't it? It's health. And we've had a specific question about HIV, being HIV positive but undetectable. Would they still be able to relocate, or what are some of the health issues that would get in the way of getting your visa?
I'll just interrupt there. We've just had New Zealand Shores get a visa for a gentleman who was HIV non-detectable, which was amazing, because him and his family will bring amazing skills to New Zealand, and New Zealand recognises that that's not a life-limiting disease, and there's great treatment, as with many, many, many disorders, even diabetes type 1. So New Zealand Shores are great when it comes to medical exceptions.
Yes, that was my colleague Rachel who got that over the line. I do have a family who unfortunately been stuck due to COVID, but similar situation where the HIV is undetectable. And prior to the border becoming restricted, that was well on track to being approved as well. So I'm sure we'll get that over the line as restrictions continue to ease. In regards to health conditions, things that make you ineligible for a visa, it's the big stuff. It's things you would likely already know you have. There is a very specific list with immigration, and it's quite specific as well. And just because your condition might be listed on that list doesn't necessarily mean you won't get a medical waiver or an exception to instructions. HIV's on that list, and just like Prudence said, we've just had someone get a visa granted who has HIV that's undetectable. I have had other situations where people have had conditions on that list, but because it wasn't highly severe or it wasn't going to cost our healthcare system a lot of money, immigration attaches a threshold of $40,000 over a period of 5 years. So if your healthcare is going to exceed that, you won't get a visa. So it's all about, once again, working with the individual, making sure we get reports from doctors and specialists and GPs. In some cases with children, if it's a learning-based issue or it's a developmental issue, we can get letters from the school to support, what they require in terms of assistance. So it is a really personal thing, and it does vary. So once again, if you have concerns about a particular health issue, I'd recommend reaching out to us. Whilst we're not doctors, we can generally sort of look at it and say, yes, this is likely to be approved, or no, it's not.
Yeah.
What's your experience? Yeah.
From our perspective, we do, when we interview you, we ask some personal questions about your BMI, so your body mass index, if you're on any medication, if you've had any time off from work, you know, if you've had a hip replacement or you've had any mental health disorders, as long as you're stable and good for work, we're great, we'd love you. We have, even if you've got a fatty liver, or you've got any blood test, your lipids are a little bit high, or if there's anything, they will look closely at it. But, you know, once, and even we're still working on it, but only once in 25 years of recruiting have we had someone declined on medical condition, but they're still going through the process. That is actually since resolved. So never in 25 years have I had anyone declined on a medical condition for immigration, because we know that we want you in New Zealand to help our New Zealand health system. So even if you have need a medication or need treatment or counselling or anything once you get here, that shouldn't be a problem.
Okay. There is a question about job roles. So we've had questions about physician's assistants and dentists. Is there a detailed list of what constitutes critical work, and would a pediatric specialist count?
From a visa perspective, all medical professionals are deemed critical. If it was a general medical nurse, it was a midwife, it was a theatre technician, a specialised paediatric orthopaedic surgeon, no matter what, they are seen mostly as a shortage on the shortage skill list in New Zealand. So I hope that answers your question, that you don't have to be super specialised to be seen as a critical worker.
Yeah, I understand it. Oh, sorry, Charlotte, do you want to add to that?
There is a list, and Prudence is correct. You don't have to be super specialised, but there is still a list. But basically, if you are a healthcare professional, then you will get a visa. But perhaps Fabien can drop the link in. But once again, reach out to one of us and we can double check that for you.
I think the confusion comes is when you say healthcare, and some people in their minds are like, well, how far does that extend? Because we had a question here saying, I was looking on a New Zealand job website and I saw a job as a care coordinator that looked like something I would really enjoy. Would I need to be registered with the council to do this work? So that sounds kind of healthcare. Is that included?
It's if they were working as a nurse, then yes, or if they were working as a carer in like a rest home, then yes. But anything that's admin related, so even if you got a job offer, let's say with like a hospital, but you were working in the HR department, even though a hospital is a critical service and you're working for a healthcare provider, because it's an administration role, it's not on that list. So you do specifically have to be working as a healthcare worker rather than like a supervisor or a manager, unless that role has sort of like hands-on, you're actually providing care to people.
Okay. There's another question. I'm a physiotherapist here in the Philippines. I'd like to ask, what are New Zealand's requirements or qualifications for me to practice there?
The best idea would be to email us and we can send you the link to the registration process. First and foremost, you need to get registered in New Zealand. I have employed one occupational therapist from India, but never a physio. And because you have to get the registration in New Zealand first, often it will be about sitting the IELTS. So if English is a second language, you will sit the IELTS, which is the International English Language Testing System, and you'll see IELTS come up quite often. If you're from the UK, often South Africa or the US, you won't sit the IELTS test. But for residency and immigration, you may need it as well. So just bear that in mind. But for a physio coming from the Philippines in 25 years, I haven't recruited a physio from the Philippines. So it's a matter of just checking with us and let's look at your qualifications. If you may have worked in the UK, for example, that would help.
Okay, another question we've had come through is which exams are required in order to migrate to New Zealand as a doctor? Would that just depend on where you're coming from?
I've never had a doctor have to sit exams because they've always been board certified. If you're board certified, you don't sit exams. So okay. You shouldn't have to sit any exams coming to New Zealand, which is great news because I'm sure you've sat plenty.
Okay. We have a question from a registered nurse of New Zealand. I'm already a registered nurse of New Zealand, but have yet to work in your country. Are you taking nurses from the US during COVID-19?
We absolutely are. It's pretty much business as usual. And I get asked every day, are you interviewing? Are people entering the country? And yes, we absolutely are interviewing and getting people into the country. So just the process might take slightly longer to gather your paperwork, but if you're already registered, absolutely contact us.
I think that's New Zealand borders are closed, but they're really not to healthcare professionals.
They're not to health professionals, which is why we're running this webinar and meeting so many awesome people.
Yeah. Okay, a bit of a long one. My wife is a registered nurse, Bachelor of Science in Nursing with 7 years experience. However, her university is not listed in the universities that have been approved by the ministry. They're in the United States. The two of us have struggled to find an immigration or licensing pathway for her. What do we need to do so she can continue nursing in what we hope to be our new home?
Email me a CV straight away. I'll get back to you by the end of the day. That's a promise, to prue@accent.net.nz. Don't everyone do it, but just take your time. Email me your CV. I'll be able to say yes or no about getting registered, and then I can send you the link to get registered, and then you have to get your qualifications verified by the CGFNS. That process can take a little bit of time. Once you've got the CGFNS, to get registered, it takes about 20 days.
That's really quick.
Yeah.
So this is something that I'm sure is on many of the people in our webinar on their minds. Is there anyone we could talk to about the differences between practicing in the USA and practicing medicine in New Zealand, especially if there's expats, you know, that could give advice to make the transition easier? Because I'm sure it's quite.
Yeah, absolutely. If people email me and want to have a direct chat, I can hook them up with, if they're a GP, for example, I could hook them up with an American GP, or if they're an obstetrician, I could hook them up with an obstetrician to talk to, so you can talk the same language pretty much. Basically, the feedback I get is quite interesting because we always keep in touch with everybody after they've started work. The bodies are the same. The patients are the same. Your colleagues are more friendly. You'll use less pain relief and there's less intervention. So one negative thing is patients in New Zealand present a little bit late. So if they've got a sore stomach, they won't come to the emergency room until they're very sore, which also can't be a good thing. You know, you're better to check those things out early, coming from a nursing perspective. But patients tend to ask for less pain relief and they ask for less intervention. We don't need to X-ray everything. We don't need to CT everything. We go on more sort of holistic information. So yeah, there are the differences. Less pain relief, less, people are a bit tougher, people present a little bit later, colleagues are quite friendly.
Okay. The next question is one that I can tackle. What are the logistics for moving around the world and across an ocean? Done that twice. What is the best way to bring our belongings with us? What should we anticipate needing to save or spend? All those kind of things. So I do have a playlist on my YouTube channel where I answer a lot of these questions. Every time I think I've answered all the questions there can be, I get more questions coming through. Obviously, it's just from my perspective, but the answer to most of these questions is it depends. There are so many factors that go into all of these things, you know, how much you're going to be bringing, how big your family is, where you're coming from, all these things. I do have a video about all of the expenses to budget for when emigrating, so you can then go and research each of those expenses that will apply to you and know your dollar amount. But if you go over to my channel, which if we could have someone pop that into the comments, that will be covered in there, and obviously in the group, because my videos is just from my perspective, but in my group, there are, like I said, over 16,000 members, and there's a lot of different perspectives and experiences, and people can help each other. There's a question perhaps at the end that you guys can answer. Is it common practice for employers of skilled labor to help assist in or offset this cost because immigrating is so expensive? Is any of the logistics of it, the shipping things and getting settled, covered by any of the employers?
Yeah, that's an interesting question, Jen. At the moment, some employers will have to pay for isolation, so that's $3,000. So they often pay for isolation, but may or may not pay flights, may or may not assist with accommodation. It just depends on their budget, how much they've got available, if they've got housing available. To be honest, I would budget for everything and expect nothing and be surprised if you get something. At the very least, we've had every COVID isolation, the first 2 weeks in a hotel, part or fully paid for.
And what about things like shipping and accommodation?
Again, it will depend on the employer. Some employers have the budget to assist with shipping, and some employers have the budget to assist with flights. It comes down to an individual's skills and how much they want you, and how much money they've got available.
Yeah, again, it depends, doesn't it? It also depends, are you bringing a cube or are you bringing a 40-foot container, and where is it coming from? So
absolutely, and we'll do everything we can to help with housing, to find a house, to find a flat to go live. You want to go flatting. If you want to get into an Airbnb, we write up wonderful references on what a great flatmate or tenant you're going to be. We make up all sorts of things that, we'll get to know you over 9 months, and we'll know that you want to live in a really small, tight, clean apartment, or that you're happy in a student flat. So we'll make sure that we help you with housing. It's not just getting a job with Accent Health Recruitment, it's absolutely everything. We get the job, we make sure you've got a bank account, a tax number, a cell phone, a bike to ride, a car to drive, some groceries. The children have got schools to go to, you've got childcare sorted. We do it all. People ask what the catch is, and there actually isn't one. We provide a really, really comprehensive service. As I said, I've been doing this 25 years and I love bringing people to New Zealand. It was one of the highlights of my year, seeing 3 of my candidates, 2 doctors and a nurse, through isolation, and just seeing them in real life and know that they will make a real difference to New Zealand, and their health skills are really, really sought after.
That's amazing to have that kind of support as a new immigrant.
Yeah, absolutely. And New Zealand's such a small place that you can't actually steer someone crook, as we say, which is not a very good expression, but you can't give people the wrong information, because when you get here, they'll track you down. New Zealand's such a great, great country. I just love it. I love living here. Pre-COVID, I was in the UK, US, and Asia 3 times a year, and I love going overseas, but I love coming home as well.
That's lucky, because you can't go at the moment.
No, I know. Memories pop up on Facebook of being away on seminars and meeting people overseas, and it's a long time dream away.
Yeah.
But look, what we'll do now is we'll wrap this up. Thank you, Jen and Charlotte, New Zealand Shores. Thanks, Kristin and Hayley. We're going to put our email addresses down here so you can contact us directly. Give us a day or 2 to respond, because it's been a very busy webinar. But I really just thank you for joining us. Technically, it's gone very well, thank goodness. You probably didn't know, but my youngest son's school ran in the middle of the webinar. Thank goodness my husband's gone to pick him up. So, sorry for that lack of focus for a second there. But any questions you've got, and no question is too small, whether or not you want to know about shopping or living or working here. Salaries is something we haven't covered. You will have a good salary in New Zealand. It's not going to be like working in the Middle East or the US, where you'll earn a lot of money, but you'll still have a very, very comfortable life. And the cost of living in New Zealand is and the opportunity and the safety and the environment is absolutely priceless. We often get so many emails from people, 6 weeks, 6 months, sometimes 6 years they've been here, and they're just so grateful for this opportunity.
Yeah, I'll just add a big thank you as well. Thank you everyone for joining us, and I've actually learned some stuff from both Prudence and Jen today that I didn't actually know previously, so that's been really helpful. New Zealand Shores is able to offer free eligibility assessments. We've dropped our email addresses in there, so you can either email Fabien or myself. With a CV, please send a CV and your date of birth, because it makes things a whole lot easier for us to do that. We can provide you with a free eligibility assessment and a follow-up Zoom consultation as well, and that's all free of charge. So feel free to reach out with any questions. Yeah, once again, whether it's about shopping or bank accounts or living in New Zealand, we're happy to answer anything we can.
Thank you very much. Look, I'll just post a couple of bits and pieces down below, so you've got some information here. And a wonderful Jen has got her Facebook here, so I'll put that down there. And any questions you've got along the way, just sing out by email and we'll get back to you within a day or so.
Awesome.
Bye-bye.
Awesome.
Thank you.
Bye.